Hey, 910, Big 550, KTRS. Happy President's Day, the lamest federal holiday out there, but that's a whole other story. St. Louis Post-Dispatch, if you showed up on the Sunday edition or maybe the Saturday edition, I read it online. It's a story written by our next guest, and it is a sobering account of the heroin epidemic that is going on here in the region. Jesse Bogan? Jesse
That's
Bogan?
right. Yeah.
Welcome to Big 550 KTRS. First of all, the story posted over the weekend, some sobering numbers. 260 heroin deaths, almost 2,000 lives saved by the overdose drug Narcan, 650 in the region. These numbers, which some people say are low and underreported, is worse than the crime statistics and the murders in the region. Mm-hmm. It shows you how this article puts a face on just how bad the epidemic really is.
That's what we were trying to do, to bring the issue to the public of St. Louis and raise the question, how do we respond to this issue?
Right. How did you go about finding these individuals to tell the story? The one woman in the story is now pregnant for the third time, lost the two children, talking about wanting to keep the third, but nobody in their right mind wants to give this woman this child after she has the boy. How did you go about finding some of these subjects?
The photographer of the story, David Carson, and I, we spent a lot of time off and on over the last month and a half, walking the streets, driving around, following up on reports of areas where people have died of overdoses. And so just scratching around, we met people who also introduced us to other people, and so on and so on. That's what we get paid to do.
Sounds like they were willing to talk to you and tell you their story.
Clearly, yeah, they did. We were actually looking for somebody else who we'd already visited with at length, and weren't able to connect with her.
Right.
But in that area, we ran into Richard Skinner, and he's been a long-time addict.
Yeah.
And he wanted to tell his story. One thing I found from reporting this story is that many people, families, or the addicts themselves, they want to help. They want to tell this story. We heard that over and over again, that if by participating it'll help one person or one family, we'd be glad to help.
They also, and you brought this out in the story, it's almost like they'll tell you a bunch of, I'm going to quit, this is my last time, and then they also give you a nod like, I know I'm lying to myself. Mm-hmm. So there's almost this sort of self-realization that I can't stop.
Right.
Yeah.
And I've heard about it, addiction being called a sickness, a mental health issue. The advocates describe this in particular as substance use disorder. And so that's one of the questions we've raised to the St. Louis public, that this is the way this is being characterized. Here we've presented to you an addict, and this is their reality that they're dealing with. I mean, you make the decision. Is this a conscious decision that somebody's making every day to use heroin? Is this a mental illness? Is this an irresponsible person?
Right.
That's so we wanted to bring a story to you that took this another notch farther. We've all heard about the heroin deaths in the area.
Right.
And I know I wasn't as excited to approach this story because it's been written about so much. And so we heard about a new deadly twist in the market called fentanyl. And that really ramped it up and got us excited to get this out because it needed to be told quickly.
Fentanyl is a drug that is now they're finding in heroin, which is worse than your worst fears. And what kills me, Jesse, is the addicts tell you that don't do this, people are dying. Mm-hmm. When you and I would run in the opposite direction, these addicts run towards this drug.
That's right. Over and over, that's something else we heard, and that was a surprise to us, that if somebody overdoses on heroin, an addict sees that as an opportunity not to run away, but to run toward. And that plays out on various streets in St. Louis over and over. And we went to a couple of those places for the story. One I'm thinking about is on Louisiana Avenue, where somebody overdosed, and then a week later, the next door neighbor overdosed, and then 6 months later, somebody overdosed fatally back next door, and then it was well known that people were dying off the heroin on that block.
So it's almost like a marketing tool.
That's
this
right.
stuff is so dangerous, it's killed 3 people. And the addicts run towards this while the rest of us run away from it.
That's what the reporting showed.
Yeah. I mean, that just shows you how much of a problem it is, right? If somebody says, don't go to that restaurant, they're, right, 6 people have gotten food poisoning, no one goes to the restaurant anymore. But in this instance, the addicts, it's a marketing. It's just, I mean, that goes to show you how horrific the whole thing is. What's been the reaction since you've posted the story?
I tried to have a kind of a family weekend this weekend. I'm glad that we got the story in the paper, and that the newspaper really stood behind it. They put some powerful images on the front page, and I know it's caused a lot of people to kind of question, what to do with this. I mean, should we have this out there publicized like this? This is a majorly serious issue, and I hope people will take it seriously. And it needs to be part of discussions, and so that's what we're trying to do at the Post-Dispatch. I hope we can talk a little bit more about fentanyl in the sense that it's a synthetic opioid,
right?
And that's being added to heroin. And the special agent in charge of the DEA in St. Louis, he's well aware of this, and he talked to us about it, and it's 50 times more powerful than heroin itself, and the purity levels of heroin have also increased so much in St. Louis over the last 10 years, and so you've really got more risk out there for hardcore users, like some of the people in our story that were on the front page, and then for people who are just getting into it, and so. They say a little bit on the tongue of fentanyl will kill you.
Right.
And so even if you're an experienced addict and you have, addiction that has you doing heroin every day, that is very risky, and that helps explain why the numbers have gone up so much. In St. Louis City, 256 people died in 2016, and that's double what it was last year. And half of those bodies had fentanyl in their system.
You purposely didn't. You can only write so much in a story, but you stayed away from elected officials. Was that a conscious choice?
Yes. When I first came back with some information that showed the alarming rate of fentanyl deaths actually in St. Louis County, I came back to the newspaper and spoke to my editor and said, "This is alarming. We should do something on this right away." And more people came and became part of the discussion, and there were talks about how do we present this story. Do we do a series of stories over 3 days that look at all that, at the issue itself, the addict story, the death toll story, but also the public policy response. The more I reported on this with David, I felt the urge that we need to get something on the record right away, and then follow up with what the public policy response is. And David and I, a week before this story came out, a week and a half before the story came out, we did a story in the St. Louis Post-Dispatch that I don't think hardly anybody read, or at least they didn't notice it. And we reported that 650 people had died in this region, and it was at a press conference right after the Super Bowl at NCADA.
Right.
And the last time I checked, there was maybe 0 comments on that story. And so I'm glad that we were able to provide a in-depth story that people could read and consume and make them think about it.
The 650 is a shocking number in the region. But the one they're all shocking numbers, but the almost 2,000 overdoses that people have survived to go back on the street, beat somebody up, steal their purse, steal their money, and do it again. Mm-hmm. So we're not solving the problem by keeping them alive and then letting them overdose again.
Right. You're bringing up issues here about addiction. That's one story I would like to do, is looking at addiction-driven crime. I'm not sure what the statistics are about how violent all addicts are, but I know from writing about mental health that mental health advocates will tell you that a low percentage of people with mental illnesses are violent.
Right.
And the people that we met who were addicts, I know some of them have broken the law before. I didn't get the impression that all of them were raging across the streets, beating up people and breaking into people's houses. A lot of them come from families that have dealt with them and their addiction for years, good families, and they've been put through the ringer on this. And by the time Jesse Bogan and David Carson show up and ask them about it, it's like they've been through so much that talking to us is such a small thing.
Right.
There was a family that's in the story, the Athenis family. Really glad to get their story in the paper, where they live in South St. Louis near Chippewa and Hampton, and the father died in 2009, left behind 3 kids. His oldest son died. It was one of the people who died in 2016, one of the 256. And they share this story about how addiction has been like a sickness in their family.
Yeah, it was a picture of the father and the 3 boys, and the father's dead, and one of the sons is dead over a heroin overdose.
Right.
Yeah. The other interesting part of the story was this is a must read. But one of the things was, and I forget who it was some law enforcement official who went out and drove around and said that every other call they go on is an overdose call.
Yeah, I think it's Dr. Gilmore, who's the medical director for the fire department, and he goes on right along so you see what the different paramedics are seeing out in the street. And then the night that he had gone out, he said that every 3rd call seemed like an overdose, and one of those calls was actually to a woman's home to revive a woman who had just buried a family member from an overdose. And so, the use of Narcan has gone up quite a bit in St. Louis from, I think you mentioned it, from 1,200 times in 2015 to 1,900 times.
Right.
And they're making a move now to try to equip all the pump trucks, the fire trucks, with Narcan, and that's supposed to happen soon. It's been delayed.
Do we have any idea of those 1,900, almost 2,000 people? Is it 500 people who've been overdosed 4 times? Is it 2,000 people have done it once? Do we have any idea the number of times people have been revived?
Right. I don't know, but I do know that the addicts themselves say that they've been revived several times. The Athenis family that I brought up just a little bit ago, that's one thing they mentioned about Tommy Athenis, who died in 2016, is that, he overdosed twice in one day one time. He was in an ambulance. His grandmother said it would seem like 100 times. His brother said, no, I think it was more like 30 times. And the question he raised to me was, is there some kind of system in place that can kick off to say, hey, we've revived you 30 times. Maybe we ought to do something else with you.
The one guy was revived 30 times?
He was in an ambulance 30 times.
30 times.
So they must have done something to help revive him.
Right. It's just inhumane to revive someone 30 times and not try and give him the help he needs, right? I mean, that's not necessarily a question for you, but just sort of I'm asking the ether. There's something wrong with just being overdosing 2 or 3 times in a day. Yeah,
and I didn't report very deeply on what services there are out there right now for people whenever they do come in as an overdose. I know, they take them to the hospital typically, and they observe them for a while, and then eventually they're let out, and I think they're told about different programs that are out there. There was a sense of urgency to get the story out there that these numbers have gone up so much.
Right.
And so I'm not just the only reporter at the Post-Dispatch who's interested in this topic. There are other stories coming down.
Yeah, no, they're all different sides and angles and everything else, but a unvarnished look at the front lines of heroin addicts. It's a pretty sobering story. Jesse Bogan, St. Louis Post-Dispatch reporter. The story is called "The Mass Killer: St. Louis Heroin Death Hits a New High." 260 in the city, over 650 in the region. Jesse, thanks for coming in. Good work.
Thank you.
924, Big 5.